cotton buds. I see a lot of people, and I myself ada patient. 3 pagi datang, doktor, saya gatal tadi, lepas tu saya pakai jari, lepas tu macam gatal lagi, lepas tu saya ambil cotton bud, lepas tu saya cuk. The next thing you know, blood comes out. Usually, which part starts bleeding first if you use a cotton bud?
It could be the ear canal, because that's the first thing that you encounter, right? When you insert the cotton bud. The next is, of course, the tympanic membrane, the eardrum. So that is not good because it can cause tearing and also perforation of the tympanic membrane, which could be permanent. If it's just a bit, then maybe there's a chance that the eardrum can recover on its own. But if it's big, then you end up with a perforated tympanic membrane.
Hai dan welcome back to KoPiJom di Tawakal Specialist Hospital bersama saya Dr. Frank dan Dr. Tengku Ezulia, an ENT specialist. Dr. Tengku, how are you today?
I'm good. How are you?
I am doing very fine myself. Thank you very much. I myself work in emergency, right? Okay, so I see a lot of patients, they self-diagnose, okay? From my clinical judgment, I think it's just some viral infection lah. Could be influenza, could be even COVID, kan?
Right.
But they come to me dengan ChatGPT dia, dengan apa dia, kan? Doctor, I have sinusitis. I want to be referred to ENT. How do you go about that? What is the difference between sinusitis and the common flu?
Alright, okay, so this is actually very common question. Even when I give talk to the general practitioners, this is one of the most favorite questions. So actually, to make it simple, if it's less than 7 days, the symptoms, you can treat as simple flu. If it's just runny nose, nasal blockage associated with like mild cough, or maybe mild fever, it's most likely is viral in origin, and usually it will subside after 1 week, right? But if the symptoms persist longer than that, you might have to think that maybe is there something else? Especially if this is not the first time and it's been occurring for...
So it's the duration?
The duration. One is the duration, the severity, and also other associated symptoms like headache, facial pain, any eye involvement.
And then to the facial nerves.
And then the mucus. Is it yellowish or greenish or something like that?
What if the patient is colorblind? No, I'm just joking. All right, hopping back. We also get a lot of patients in clinics, in emergency. Sometimes they don't even reach you, right? They come to my emergency, and the most common infection I see is ear infection. Right? Ear infection, otitis media, and all this, right? So for the people at home, is there any warning signs yang if diorang ada this symptom, they should be worried and they should seek medical attention immediately? Ada tak?
I would say for the ear part, if you encounter something that is called sudden sensory neural hearing loss, okay, the symptoms would be sudden loss of hearing. You tengah buat anything lah, probably you're doing your work, or you're playing with your friends or something like that. Suddenly, tak bunyi pula. Suddenly,
I tolong.
Okay, you tolong. Okay, thank you. Suddenly, you tak boleh dengar. Ataupun there's like a huge drop in your hearing. So
unilateral ke bilateral?
Usually unilateral.
Sebelah
so
lah.
That is actually an emergency, a sudden sensory neural hearing loss. Why? It is time sensitive. You need to start patient early on treatment so that we can restore back the hearing. If it past the golden window, then...
So it's like stroke?
Yeah, it's like that. Yeah. Yes, it's like that.
Right, so we need to treat immediately.
Yeah, need to treat within the golden period because after that the prognosis will be not good.
So their hearing might not recover fully.
That's right.
So guys, okay, kalau tiba-tiba kita dengar and then kita tak dengar, that is an emergency, okay? Yes. Kalau tak dengar and you betul-betul tak dengar, bukan mak jerit you tak dengar, tak, tu lain, okay? Kalau you betul yang tu selektif. Kalau cikgu kita tak nak dengar, kalau mak kita tak nak dengar, kalau girlfriend kita dengar, that is selective. Akan tetapi kalau kita tak dengar, usually doktor cakap mana? Sebelah. Alright? Sini dengar, sini tak dengar, you need to go seek medical attention immediately. Hopping on to that, lagi satu. Nowadays, you see a lot of people pakai headphone besar-besar ataupun more famously atau more
that's
popular.
the trend that I see.
AirPods, right?
Yeah.
Okay. Even on our iPhone setting, dia ada maximum volume, and then after that, if we go past that volume, dia ada macam warning apa semua tu kan. Is that really dangerous to our eardrums?
It is dangerous to our hearing. It's because prolonged exposure to loud noise can really damage the hair cells inside the inner ear. Okay, so if it's just a short time, maybe the hair cells can recover. But if this goes on for quite some time, there might be a permanent damage to the hair cells. As a general rule, to keep it simple, remember the 60-60 rule. Okay, so the volume should not exceed 60% of the total volume. And also the duration wise, do not go more than 60 minutes. You have to take breaks in between.
Oh, so if we listen for more than 60 minutes but I reduce the volume, boleh? Tawar-menawar sikit lah.
Tawar-menawar. I guess it's better than, if you exceed both the 60 and 60.
Okay, so you want to listen to at least 60 minutes and then take a break?
Yes.
Break ideally at least 5-10 minutes.
Correct.
So, orang di luar sana yang kerja di office, yang pakai headphones for prolonged periods, you can ask your boss, okay, I need a 5-minute break, I need a 10-minute break. Kalau tidak,
Yes.
my
Doctor's
telinga akan
advice.
rosak. Yeah, doctor's advice, yeah? Okay, so hopping on to that as well, the trend, sekarang banyak trend lah kita ada. One is the headphones, one more is, if you notice, wherever we go now, we masuk mall, masuk hospital, balik rumah, everywhere is aircon. Aircon. What does that do to the human body? Does it dry us up? What does it do?
Okay, so prolonged exposure to aircon, which I think all of us are guilty, especially we are staying in Malaysia, right?
Especially if you're in the OT and it's extra cold and it needs to be like that.
That's also
Okay,
correct.
So you're
Yes,
quite
that's correct.
guilty, Dr. Tengku?
Yes. Okay, so what the aircon does to a person is that it can dry up the nose and also the throat. So our nose needs some mucus and also moisture. But if there is drying, especially with prolonged duration, right? And then especially if the aircon is not well maintained. So macam tak tahu bila last buat filter, aircon
Quality
filter
of the
kan.
aircon.
Okay, yeah. So maybe ada dust. So the drying, exposure to dust mites, and patient that probably already has some allergy components
Some
or
underlying
sensitiveness.
allergic rhinitis ke.
So all this will worsen and also cause inflammation of the respiratory systems, including the nose, the throat, and also the bronchus and so on. So it can cause chronic inflammation of the respiratory tract.
Okay, so guys, what's the take home message hari ni? Moisturizer bukan sahaja untuk muka. Your nose and ears juga perlu di moisturize, betul?
Betul.
Okay, but we cannot use moisturizer yang kita pakai dekat muka.
Tak boleh.
So anyhow we can moisturize our mucus other than our moisturizers.
Well, first is to cut if it's possible to cut down the exposure. Okay, so that is one thing. Number two is I think have to be cautious with the ventilation. So sometimes when you on the aircon, you tak buka dah tingkap kan. So it becomes very poorly ventilated space. So tu nombor dua lah. And then if you want to take something lah to help with the moisture, I suggest that you can use like nasal rinse or we also have like hyaluronic acid nasal spray for your nose.
Okay, so yeah, hyaluronic acid is very useful. Not only in your face, but also in your
for the nose.
Betul?
Yes.
Yeah. Okay, so right now I want to talk about a very big topic that a lot of people are suffering. Okay, tapi orang yang suffer tu tak tahu dia suffer. Yang suffer tu usually is the spouse.
Okay.
I
I know where this is heading. Yeah, snoring.
Snoring is okay. Let me start off by saying ENT ni is kadang-kadang they are life threatening. Okay, sometimes I understand you sometimes deal with life or death situations, but more often than not, okay, the symptoms that your patients suffer usually they are chronic. Okay, even they are suffering these symptoms, they can go on about their lives. Okay, that means it's affected their life. Tetapi tak affected sangat sampai they would want to jumpa a ENT specialist. But sometimes the wife or the husband dah pok-pek bising dah. Can you do something about your snoring? Can you tell us more about snoring?
Okay, it's not a problem of snoring. It's a problem of obstructive sleep apnea. So there's a difference between just primary snoring and also OSA. Okay, so the difference is if it's just snoring, then it's okay because it's probably not going to, it probably going to affect the quality of your spouse sleep, kan? But it doesn't affect you personally in terms of your ventilation, your oxygenation, your cardiovascular system. But if you have obstructive sleep apnea, is something different, something that is very dangerous to a person's health, especially in long term. Because it can cause reduction of oxygenation, okay, in the blood, and of course to the vital organs, to the heart, to the brain, to the other parts of the body, and it can lead to hypertension. It can cause a strain on the cardiovascular system. It can lead to stroke, heart attack, and so on.
All of this.
Oh yes, all
in
of
their
this.
sleep.
Correct. It's
so they
happening
count,
bit by bit, worsening every time in their sleep.
Yeah, because we get a lot of in the emergency, we get a lot of obese patients that clinically their bloods wise everything is okay, but clinically when you look at them, you know that they are what we use as stop bank score. Stop bank score is quite high, so it's quite indicative of OSA, wouldn't you say?
Yes, definitely.
Intubating a obese patient has its challenges, and the failure rate is high, and intubation is not something we take lightly.
Correct.
Okay,
We want
is
to,
life or death.
Yeah, we want to secure the airway as fast as possible, right?
Yeah.
It's for the patient's benefit. But that would be the challenge lah if we encounter an obese patient, to lift up the patient, to secure the airway,
to adequately give oxygen
Correct,
and everything.
correct.
It will be quite difficult. Okay, so you need to start taking care of your health today. But with obesity comes a lot of problems. Snoring is the least of your problems. But okay, if you want to hop back onto OSA, you will get a lot of very vague symptoms. Would you share what symptoms a patient suffering from obstructive sleep apnea will go through?
Alright, so they will have snoring and also choking during sleep. So usually because of the reduction of the oxygen during sleep, so they will have like choking and sudden waking up from sleep because the brain is telling them to wake up and inhale and take more oxygen. So yeah, and because of that, since the sleep is interrupted, right? So they will have daytime somnolence. Some of them may not wake up, but because of the poor oxygenation, they will still have like fatigue. Feeling of tiredness, like excessive tiredness during the day. Poor memory, poor work performance, or if they are still attending school, college, poor school performance. Yeah.
So this is all very, very vague symptoms. Okay, you see all this poor performance lah. Kalau orang tengah kerja, you mengantuk, and all this you might take very lightly. Like sebab I tak cukup tidur. You bukan setakat tak cukup tidur, you sangat-sangat tak cukup tidur. One night you can wake up like kadang-kadang 5 kali, 10 kali when a perfectly healthy person goes to sleep. That's why you're tired. It is not just a very, very vague symptom. It's a symptom you can treat right now. Right? You need to meet Dr. Tengku lah. Dr. Tengku will solve all your problems. Okay? Talking about kids. Okay, let's come back. Okay? Talking about kids. I know a lot of mothers and a lot of kids, they like to use this thing that I myself do not prefer. Okay? Cotton buds. I see a lot of people, and I myself ada patient. 3 pagi datang, doktor, saya gatal tadi, lepas tu saya pakai jari, lepas tu macam gatal lagi, lepas tu saya ambil cotton bud, lepas tu saya cuk. The next thing you know, blood comes out. Usually which part starts bleeding first if you use a cotton bud?
It could be the ear canal, because that's the first thing that you encounter, right? When you insert the cotton bud. The next is of course the tympanic membrane, the eardrum. So that is not good because it can cause tearing and also perforation of the tympanic membrane, which could be permanent. If it's just a bit, then maybe there's a chance that the eardrum can recover on its own. But if it's big, then you end up with a perforated tympanic membrane.
The eardrum, guys.
Yes, the eardrum.
But then on the flip side, the good news is kalau your wife marah, you tak dengar sangat. That's a good thing, right?
If you think of it that way, I guess.
Yeah, so in
the blessing in disguise.
Blessing in disguise, huh?
Yeah.
The glass half full, half empty, kan?
Right.
Wait, so in the beginning, you talked something that a lot of us are not very familiar with, okay? Your ENT side, okay, might have tumors, you mentioned in the beginning. Would you elaborate more about the tumors that might involve the ENT organs?
I would say first is usually the warning sign if it's anything unilateral compared to bilateral. Okay, anything that is one-sided is usually of concern compared to.
What symptoms would the patient experience?
Okay, let's say it's one-sided nasal bleeding, one-sided nasal blockage, or one-sided lump in the neck. Because if it's both sides, right, it could be allergy. If it's about the hearing, it could be because of the age related problem. But if it's unilateral, meaning it's one-sided, right, if it's involving the ear, it could be the tumor of the ear, which usually happen. I mean, most of the time I would say 80 to 90% is just one side. Okay, so that is if you are talking about the acoustic neuroma of the ear, one of the tumors that can happen in your ear. And if it's nose, usually if you are talking about sinonasal cancer, okay, that's an aggressive type of tumor inside the nose, or even nasopharyngeal carcinoma, which is the cancer pangkal hidung. So usually it involves one side first. Then of course unilateral. Of course
eventually
it can go.
It'll evade to the other side lah.
Yeah, but
then
usually
they present with one side.
Yeah, if it's early stage, it will present with one side first.
How is the prognosis for such diagnosis?
If of course different tumor have different prognosis, right? Okay, so let's say lah, if we talk about NPC, nasopharyngeal carcinoma. So nasopharyngeal carcinoma, it has based on the HPE lah. Okay, so most of the time, 70 to 80% of the time, it is the undifferentiated type. The prognosis for this is good compared to the other types, which is more keratinized and also differentiated. Because if it's undifferentiated, usually patient will respond really well to radiotherapy, and surgery probably is reserved for those who,
But there is role for surgery.
Yeah, there is role for surgery. But usually the first treatment modality is radiotherapy.
Radiotherapy dulu lah.
Yeah, and usually patient responds really well.
Okay, but if they are caught early.
Caught early, correct.
Okay. So, if coming back to that, you said one of the symptoms is nose bleeding. So is all nose bleeding? Do people need to concern every time their nose bleeds?
If it happens in children, maybe both sides related to nose picking, allergies, then probably not so concerning usually if it happens in children, right? Because I think that's quite common. Usually it comes from the litmus area, which is the tempat pertemuan, lots of blood vessels at the front of the nose. Okay, so that is for kids. But if it happens in adult, it is profuse in nature, bukan sikit-sikit lah, memang susah nak stop, right, the bleeding, and also coupled with other symptoms like probably hearing loss, because usually this patient, when it affect the eustachian tube, it will cause like.
Is there like tinnitus yang bunyi?
Maybe, but usually otitis media. So they will be reduced in hearing. There's also the neck nodes. Sometimes they get that quite fast also, the lymph node.
The lymph node in the neck?
Yeah.
But it is not thyroid?
No, it's at the side, because thyroid is at the center usually. So
because
you
I get patients like that all the time. It is so deviated, tapi dia cakap dia masalah thyroid.
Okay.
Yeah, but then when you can feel nodes, usually unilateral, sebelah, very well formed, tak berapa nak mobile sangat. So that is where we need to suspect some cancer going on lah.
Right.
Alright. So you have a very interesting very interesting work, I would say.
Definitely,
Yeah,
because it
because-
covers lots of parts of the body. Then okay lah, I would say that what patient know is ENT, but actually we also cover the head and neck part, including the thyroid and also of course the neck area.
Oh, that is not what do you call that? Surgical side? No, usually
For thyroid,
it's
yeah,
a grey area.
ENT, yeah, it's a grey area, but ENT manage head neck cancer as well.
ENT manage the airway. That's all I know. Number
Yeah,
one. If
yeah.
I have an airway problem, I will call ENT down. If I
That's
cannot
right.
intubate,
The
ENT datang.
voice, the swallowing, all the things that matters in life, because for the ear you need the hearing, right?
Betul.
For the nose you need it for breathing, to smell. And also your throat you need it for swallowing, communication,
Your vocal
taste,
cords
the
nak
vocal
cakap.
cord. Yeah.
What we are using right now. Betul.
See,
Yeah.
ENT is what makes the life meaningful.
Yeah.
Yeah.
Kau ni promote ni dia ni
Promote.
Okay. So I think you have been in ENT for quite a few years. How many years?
I graduated my master, my specialisation. I become a pakar lah, a specialist in 2016.
2016.
Yeah, 10 years lah.
So 10 years now. Okay. So in this 10 years as a pakar ENT, no doubt you have found some disturbing stuff in the nasal cavity ataupun the inside the ear. Would you share with the audience hari ni, okay, in your 10 years of experience, what is the most, how do I put it, disturbing ataupun paling pelik punya foreign body
Paling
that
pelik
you have
punya
found?
foreign body lah. Okay, I'm guessing that okay, for the ear and nose tak adalah pelik sangat. For me like it's usual. Maybe if other people hear it, they would say macam wow, like that, right? But for me it's the usual lah, beads, tissue, paper, like small parts of toys inside the nose or the ear that the children usually put.
Cacing? Lipas?
Cacing, lipas, the kutu and
Ada jugalah.
Ada juga.
You see,
Ada juga.
that's for her, it's not disgusting.
Yeah.
Itu for her baseline.
That is nothing, cik.
Manik
For
tu
me.
lagi cantik.
But-
Manik.
Manik kan. What am I fishing today? Okay, but I had this one case, foreign body in the throat, because patient actually tertelan.
Tulang ikan.
Tulang ikan is nothing.
Tertelan?
Tulang ikan is nothing. Tertulang biji durian. Can you believe it?
Boleh bernafas lagi?
Boleh nafas. Tapi memang, struggling lah a bit to swallow and also to breathe.
X-ray nampak ke?
Nampak.
X-ray nampak biji durian. So today I learn.
And also because of the history lah. Tercekik biji durian. Okay, that's fine, it's fine. But imagine the smell when you try to bring it out.
Ni pakai, kita pergi balik kabinet COVID, kita buka, kita
Yeah.
pakai N95 face shield,
satu
segala
OT lah,
respirator.
Yeah, I think
Lepas
that's
habis
something.
operation tu, surgeon pengsan, Dr. Bius pengsan, nurse pengsan. Patient je jalan keluar satu orang kat situ
Patient
kan.
je happy. Patient happy. Good job doctor. Tapi all the doctors pengsan dah.
Okay, so this is the side where people don't see, you know. As doctors, we touch, we see, we smell a lot of things that a lot of people do not even thought of in our hospital. Kita dari luar nampak, Dr. Tengku hari ni good day dia baru fish out biji durian daripada tekak. Siapa tahu, right? Yeah. So, as a closing note, if you have one message you can send to the Malaysian public out there, okay? One message. What would you send out as an ENT specialist?
Okay, so I think that the quality of your life matters. So if you are experiencing symptoms that you know is not normal for quite some time, I think it's best that you at least get it checked so that you can get a proper diagnosis and get proper treatment. Because I've seen patients who, live for so long with nasal blockage and thinking that it's normal, memang born with nasal blockage and I have a bit of resdung. So they take it as normal, but actually it's not. So even something as they assume as simple as that, but actually
So seek medical attention.
Correct.
So jangan takut jumpa doktor. You nak takut jumpa dentist tak apa. Saya pun takut jumpa dentist, tapi doktor kita jangan takut. So because we will solve your problem. Okay, because a lot of people tak realise they have problems ni kan. So and all these problems actually ada solution. Okay, adanya Dr. Tengku adalah solution. Alright guys, that's all for today. That's all from KoPiJom in this episode. Thank you very much. Thank you Dr. Tengku.
Thank you Dr. Frank.